Hi guys. So today we're going to talk about gender and transgender issues and working clinically with those things. I am using webcam for the first time, so be patient with me. I'm going to try and maneuver the PowerPoint and my notes and this web thing all at the same time. So yeah, be patient with me and let's, I guess, get started. So here's a little bit about what I'm going to talk about in the video. So first, giving you some definitions of gender and the gender binary and all the terms associated with gender. And we're going to talk about feminism and the oppression of women, and then move into treatment with men and women, and then move on to transgender issues, moving beyond the gender binary into the issues that are specific to transgender folks, all the definitions around there, and then clinical application with transgender patients. So let's get started. I want to introduce this idea of there are a lot of different frameworks that we can use, and we're going to try and blend a lot of them, but I at least want to highlight that there are many different perspectives to use when looking at gender issues. So one is a biological perspective. One way to study this is to use animals and think about how male and female animals are different, but there's a lot of challenges with that. I mean, one thing is that there's not a lot of scientific support for the biological differences between the genders or between sexes. And one of the reasons for that is because biology and social experiences, even in animals, shape each other. So even if you see a highly frequent behavior within male animals, for example, that doesn't necessarily mean that it's genetically or biologically determined. So, but anyway, the biological part is still important to talk about. There's, of course, a sociological perspective, and within a sociological perspective, we can look at social differences and categories and think about different roles and power hierarchies and those kinds of things. And we'll definitely be taking a look at that today. And talking about that within class also. Another perspective is an anthropological perspective. This is the place where we can look at cultural differences. So between different cultures, are there different behaviors between genders, maybe different ways that bonding takes place, or different ways that power is constructed in between different cultures. And within this perspective, we can have we can take in history and compare across cultures. So that's another perspective. And then, of course, a psychological perspective, which is the perspective that we're going to pay, I think, the most attention to. But an important thing to think about here is that many traditional theories of development have neglected gender diversity. And so often they are constructed by men and then have kind of a male perspective. But at the same time, there may not be a wide distribution of men coming up with the framework for a psychological understanding of gender. And so then it ends up being a pretty narrow understanding of gender and the effects of biology, culture, and social experiences on what we come to understand as gender. Okay. So with that as like a beginning for the different ways that we can look at gender, I want to make note that our context is a context of patriarchy. And so within patriarchy is a system where masculinity is seen as superior to femininity and given social power. And so within patriarchy, women and anything associated with the feminine is denigrated. And then the flip side of this coin then for men is that they have to avoid those things, or they also will be rejected or demeaned or seen as less. And so when we talk about gender, we're going to talk about it within this context where certain things are valued more than others. And it tends to be that within patriarchy, the things that are masculine are seen as more valuable. Okay. So let me pause here because I'm pretty sure that the slides are getting cut off a little bit. Okay, so returning now to gender real broadly. It's important to note right at the beginning that there's a lot of diversity among men, women, and trans folks and their experiences of their gender and of our social context and how that interacts with gender. So So let me put that out there right at the beginning. We're going to talk about men's issues, women's issues, transgender issues, but of course, there's such a variety of experiences in each one of those groups. So I'll just say that to begin. And when we talk about gender, this is going to interact with what we think of as biological sex. We'll also be talking about gender identity, how one thinks and experiences their own gender, and then also gender roles, which are those things that are kind of socially placed on us, or expectations based on your gender. And we work within the US, certainly, and in many other places we work within a gender binary, meaning that there are basically two choices. There are, in general, two choices. Some people choose not to live according to those two, but the rules for our society are generally that there are two choices. One is femininity. So if you're female, that is feminine, and masculinity if you're male. Okay, so that's why it's a binary, because there are two choices. And oh no, you can't see the full thing. Hopefully you can see it a little bit. So how do we do gender? One, the little boy is like trying to be strong, and the little girl is dressed in pink like a princess or something. So this interacts with biological sex because the expectation is for those who have a biological sex as female to operate according to the feminine, and those who are biologically male to operate according to or live up to the expectations of masculinity. And then gender identity is we then also assume that how you think and feel about yourself, if you are female, you will think and feel about yourself as a woman. And if you are biologically male, that you will think of yourself as a man. But there can be all kinds of combinations here, and this is these are just the expectations that we live with because we live in a world with a gender binary. And I'll bring up sexism here. This is kind of the belief that those things that are masculine are more valuable than the things that are feminine. And so depending on where you are within these spectrums, you might be more or less valued. And so then how you interact with your own gender or your own biological sex might depend a little bit on the value that the culture or the society places on it. And I already discussed patriarchy a little bit, which is that system of valuing the masculine more than the feminine. And let's see here. I think I have something else to say about this. Yeah, so I guess all I'll say about this is that with sexism and patriarchy operating together, and which is often the case, that patriarchy comes from a sexism, that then men are given social power and privileges, which means that anything that is identified with the feminine then has less power, obviously. But this reinforces a form of masculinity that is actually dehumanizing and devaluing for men, because there's still a box that men have to be in. And then gender expression, in case you're not familiar with it, is the way that a person expresses their gender, obviously. So the way a person talks or acts, the kind of behaviors that they engage in. It can also have to do with things like social activities, hobbies, what people do for work. It could even be like a person's sense of humor. All of those things, we have a sense of what a masculine one of those is and what a feminine one of those is. And so you could find that your gender expression is more masculine or your gender expression is more feminine, and that could actually be separate from, but maybe related to, your biological sex or your gender identity. And so depending on what your gender expression is, you might be experienced as more feminine or more masculine, and within a patriarchal society, you will have value placed on you based on your gender expression. All right. So gender socialization, we are socialized from a very, very early age about what the rules are for men and women. And you might think about what come to mind for you, and we'll discuss this a little bit in class. And then bonding happens for men around those kinds of around certain kinds of activities, right? And bonding happens for women around certain kinds of activities. And so all of that is very reinforcing to operate kind of within these boxes. And these could be explicit messages from family members and peers, social institutions, but they can also be very implicit messages, maybe in the media or even within your family, that there are certain things um, that are kind of frowned upon, and you'll get subtle, maybe even passive kinds of social punishment or reinforcement for different behaviors. And then the psychological experience, I spelled that wrong, the psychological experience of not fitting in can be really, really powerful. And so then we adapt our behavior and our identities in order to fit and not have the psychological pain of not fitting. And we do that as much as we can, but for some people, it's a very, very painful process. Okay, this slide is a little bit about the consequences of this gender binary, these rules that we have, and that there's only really two options around those. So in case it's not clear, the gender binary is this artificial division of the world into things that are masculine for men and things that are feminine for women. And then activities that are masculine are considered more prestigious than those that are feminine. And there can become these gender binary fractals. So meaning even if something is considered masculine and therefore has prestige to it, there might be subparts that have identifications too. So for example, within sports, there are some sports that are more masculine than others, and those sports that are more masculine are valued more than those that are more feminine. Or within workplaces, so like the tech industry is more masculine generally, filled with men, but then there are those pieces of it, maybe design or something, that are seen as the feminine subparts. And within feminine things, there could be fractals that also have identifications. And also there are revisions that happen over time. So for example, names. So if there's a name that is androgynous or relatively masculine, over time, if that name is given to enough women or girls, then it could lose its prestige. It's almost like what is feminine is poisonous to the thing that is masculine. And that changes the status of that thing, like a name or like a job or like a sport, over time. So those are some of the consequences of the gender binary. So still sticking within the gender binary, I want to cover some current issues. One is sexual harassment. There are large numbers of women who are sexually harassed, 1 in 6. Generally, a lot of this happens in the workplace at high levels, but also low levels of when you think about a hierarchy in a workplace. And also men experience sexual harassment in the workplace. And in case, I have a definition of sexual harassment in case it's not clear for you. So it could include sexual coercion, meaning job threats or bribes, forcing an employee or someone that you work with into a sexual relationship. Sometimes it's less clear than that. Anything that is an unwanted sexual advance, an unwelcome sexual attention would be considered sexual harassment also. Any kind of pressure for any kind of romantic anything could be considered sexual harassment. There's also just kind of gender harassment, which could include mocking based on someone's gender, or offensive remarks or threats based on a person's sexuality or gender. Okay. Domestic violence is another huge issue. So 1 in 4 women experiences domestic violence, maybe 1 in 10 men. But with all of these numbers here, it's really important to remember that there's a stigma around men admitting the harassment or the violence or rape or abuse that they experience. And so it's hard to even know what these numbers mean, but it's important to keep asking, but we can guess that these are underreported. So domestic violence is definitely an issue. Let's see here. Let me move on to rape and sexual assault. I have some more numbers on that. So 1 out of every 6 American women is the victim of an attempted or completed rape. 1 out of every 71 men, but again, a serious problem with underreporting here. Thinking about rape and attempted rape for women, when we look at race, all women is about like 17%. This is a study that was from 2008, I think. So this might be a little bit outdated, but so if we think of all women being generally about 18% of women, those who are American Indian, and we'll talk about indigenous experiences in a couple weeks, but those who are American Indian or Alaskan Native are up to 34%. Mixed race women, 24%. So folks who are ethnic minorities, racial minorities, experience this more than some others. But it's interesting that Asian or Pacific Island women experience less rape in their lifetime. So something to think about there. I don't know what all those numbers mean, but interesting to think about. Let's see. So girls ages 16 to 19 are much more likely than the general population to experience rape. And 93% of juveniles who are attacked know their attacker. So if we talk about the experience of this kind of sexual assault or violence and what are the consequences of it. So one thing that we know is that that there are these mental and emotional consequences. One thing being depression, so 3 times more likely to experience depression, 6 times more likely to experience post-traumatic stress disorder, 13 times more likely to experience alcohol abuse, and then even more for drug abuse. Okay. Also, suicide becomes an issue for folks who have experienced sexual assault. All right, let's see. I have some other things to say about international issues of sexual violence. The World Health Organization considers violence against women a major public health problem because the economic strain that sexual violence creates on an economy is huge, and there are so many kinds of issues that come with it. But global prevalence figures indicate that 1 out of 3 women have experienced either physical or sexual intimate partner violence. 1 out of 3 women. Factors associated with this have to do with low education, child maltreatment or exposure to violence, family exposure to violence previously, harmful use of alcohol, or just general cultural attitudes associated with accepting violence and just general gender inequality. Those are factors that are related to sexual assault. As I was saying, there are a lot of consequences to this. Suicide, homicide are associated with violence against women. 42% of women who experience intimate partner violence report an injury as a consequence, so a physical injury. Other things are associated like gynecological problems, abortions, STIs, including HIV. Other things that are associated have to do with sleep disorders, eating disorders, emotional distress, PTSD, I already said, problem drinking. So those are, there's a lot of international focus on this right now. More current issues. Unequal pay is a huge issue for women, getting paid about 78% as what men make for the exact same work. Also, division of domestic labor. So some people talk about this as work-life balance. This is a huge stress on women. It's also a big stress on men. How are they going to handle family and also employment? So for women, there tends to be a feeling of guilt. They should be staying home, or there's some sort of like ideal mother image out there that you feel guilty if you don't kind of meet that. Also, there are these stereotypes that women face. The super mom and trying to achieve that, the soccer mom, but also you can think about stereotypes of women in the workplace, and one of those stereotypes might be like this nasty corporate climber bitch, basically, that women who are like assertive and in control in the workplace might be seen in there's this negative stereotype. Media representation. So I have some figures on this that some studies show a nearly 3-to-1 margin of male front page bylines for top newspapers. So men are more likely to be quoted and more likely to be writing the stories in the news. Also, Sunday morning TV talk shows, only 14% of those interviewed in one recent study were women. Talk radio, sports radio, yeah, those are overwhelmingly covered by men. Online news sources about so male bylines outnumber female bylines at 4 of 6 sites reviewed. Let's see what else. When we think about films and directing TV and film, women are only 9% of the directors of the top 250 domestic grossing films in 2013. So when we think about the kinds of movies that are being made that are the most popular are often created by men. What else? So thinking about the glass ceiling and thinking about employment opportunities for women, only 14% of the top 5 leadership positions were held by women in the S&P 500. Even worse, out of 500 companies, if you think about the very top, there are only 24 female CEOs. If you think about that very top level and the CEO position, and there's this thought. So if you were to close your eyes and if I said just picture a CEO, most of the time what people picture is a white man. And so there's this need for women to experience more support, folks who will sponsor them and will actively campaign for women's advancement in the workplace. And Pew recently did a study about why women are maybe not climbing the corporate ladder and having equal representation in the most powerful positions in businesses. And at least according to the public, when they were polling people, it's not that women lack toughness or the chops and the skill sets to do those top jobs. What they found is that only 1 in 5 women say that it's family responsibilities, that work-life balance piece. But instead, for the top reasons, 4 out of 10 American women say that there's a double standard for women, that they experience this, what do they call it, a double standard for women, so that they're asked to do more than their male counterparts to prove themselves. And they say that this is one of the reasons why they're having a hard time reaching those higher levels of employment. I think that's all that I have about that. So I also put this picture up here of all the single ladies. This is a book that came out that I heard about recently, which is really interesting. And there's a rise in unmarried women, especially. It's a trend throughout history that those women who are not married and who choose to focus their energies on career or on advocacy tend to be shapers and movers within society. And as the age of marriage is increasing within the U.S., it's creating a certain kind of social phenomena where women who are unmarried are are feeling independent, entering into the workforce, and then experiencing all kinds of interesting things as they're doing that. And so this book is kind of about that, because society is changing where fewer women are getting married at early ages, and that's shaping the culture here. Okay, so real quickly, these are some things to think about if you're working with a woman. There are some common issues or concerns. They might be body image, self-esteem, weight, bearing children. And those are all common issues and concerns because of the pressures that women face. You might consider the feminine ideal in that particular woman's culture or group. So, for example, the beauty ideal within white Americans is going to be different from that within Black Americans. And so think about these common issues according to the intersection of other identity categories for the person that you're working with. Look at symptoms and also consider the community that the person is from and common expressions within the community. So we don't want necessarily to overdiagnose certain things because of they could be cultural expressions, for example. That if there is within a certain culture a feminine ideal of a lot of highly emotional expression, that doesn't mean that that person necessarily has a personality disorder. You have to think about the feminine ideals within a certain culture and then compare that woman to the norms within that culture. All right, don't look only at internal causes for symptoms, also look at actual experiences of discrimination and microaggressions. This is true within all of these minority models that we're looking at. You don't want to basically blame a victim for the aggressions that they've experienced or the discrimination they've experienced. And stereotypes of women. So I think we've talked a little bit about stereotype threat, that when a woman, for example, is reminded that women tend to perform poorly on math tests, that woman, if she's given a math test, is going to perform more poorly, because the threat of being stereotyped or fulfilling a negative stereotype about your own identity then is going to negatively impact your performance. So we internalize these stereotypes, and they can really affect psychology and behavior, cause anxiety. And so these are important things to consider when you're working with a woman. Working with men, basic principles, again, we need to not stereotype here, but there are some things that men, that we want to remember about the experience of men. So the stereotype of men sometimes is that they don't have strong desires for deep, intimate, heartfelt connections. They don't have strong emotions, but we need to remember that many men do have strong desires and longings for intimate relationships. Okay, men have a full range of feelings, and so we don't want to foreclose emotional exploration with a man. Let's see, when in pain or wanting relief, men are often conflicted about acknowledging this, because that has been deemed feminine within our culture. And so it's important to remember this and acknowledge that there might be fear about that. And that would be completely valid, because there are lots of places where there would be negative consequences to appearing weak or vulnerable. And then, of course, look at the intersection, just like we said with women, look at the intersection of masculinity and other cultural variables, such as religion, but ethnicity and heritage, race, age, all of those things. Okay. Guidelines for gender-sensitive counseling or therapy. Recognize that they may, depending on the culture that they grew up in, they may have difficulty entering counseling. It's seen, generally, it's seen as a more feminine activity. It may be a good idea to help a client save masculine face, meaning that it might feel shaming to certain men from certain kinds of cultures. It may feel shaming to some men to like really lean into certain kinds of emotional expressions. And so you can communicate genuine respect for them by not asking them to do that or making them do that. Educate men up front about the process of therapy, check out assumptions, be patient. If there are walls put up, understand that that is probably for a very good reason. And so a strong therapeutic alliance is going to be helpful with that. Use approaches that are congruent with their gender role identity. That may be obvious, but we don't want to just do a really feminine form of therapy either, because that's not going to be what's most helpful for someone coming into your office who's more masculine. Obviously, be genuine and not fake. If someone is not, if a man that you're working with is not real comfortable with direct, very emotionally expressive kinds of communication, there are other ways that you can do the work without doing that. So such as metaphors and stories, those kinds of things can be helpful to get the same kind of work done, but just in a different kind of cultural way. Okay, now we don't have a lot of time, but I want to move beyond the binary now. So we've been talking about men and women, but gender expression can be on a continuum. So gender expression and gender identity can be separated from sexual orientation and biological sex, and put gender on a spectrum. We already talked about this a little bit, but gender expression, the way that you talk, the way that you, the kinds of activities that you do, your behavior, your expressions can be on a range from feminine to masculine, with more androgynous in the middle. And then, of course, someone's personal identity is incredibly important. Each person defines this for themselves and will find, hopefully, a place that feels comfortable for them. All right. So here's a bunch of examples because these can be mixed up in all kinds of different ways. And next week, we're going to talk about sexual orientation. That's going to be another piece of this. But so for example, gender identity, if you look at the figure at the top, there is someone's womanness is on a continuum, manness is on a continuum. So I identify as a woman. So I would be high on woman, I would be pretty low on man, and so I would just be like a woman, right? There are going to be men who are really high on manness and low on womanness, and then they're man. But those are the ones that we're more familiar with. But there are other options, like two-spirit is something that is more common in indigenous cultures, Native American tribes. And so they might have womanness and have manness, right? There are those who might identify as genderless because they don't identify at all as woman or at all as man. Okay. And then genderqueer might be a way that someone expresses that they don't fit neatly into this womanness or manness, that maybe it's kind of a little bit of both in some kind of combination. Gender expression, there are those who might be agender, those that are masculine, those that are feminine, and all kinds of combinations. So, for example, now we're getting into sexual orientation too. But so if someone is a woman but has a masculine gender expression, we might call her butch, right? If a man has a more feminine gender expression, then that person might feel like they are more like metrosexual or something like that. Gender neutral, hypermasculine, androgynous, those are all other kinds of examples. Biological sex. So biological sex has to do with organs and hormones and chromosomes. So if someone has all of those things that are female, then they would be female, all male, male. But there are those who have a combination, and then they might be called intersex. But there's a lot of different combinations of those things too. If someone is born intersex, so maybe has chromosomes that are female, but then has maybe some organs or hormones that are male. Oftentimes what happens at birth is the mother or father or the doctor makes a decision about whether or not this child is going to be female or male. And sometimes there are even surgeries, or there are things that happen right there soon after the child is born to kind of make that determination, assign that baby a sex, right? That when there is some sort of combination. So a child might be female sex identified or assigned at birth, right? And that tells you that there was maybe an intersex situation, but there were those in power who made the decision that this child is female or this child is male. Okay, then next we're going to talk about attraction and sexual orientation. So we're not going to talk about that piece of it right now, but of course then attraction is in there too, and that's kind of a separate piece of this. Okay, so trans issues. What does transgender mean? Transgender encompasses any individual who crosses over or challenges their society's traditional gender roles or expectations. And so we can think of transgender as a huge umbrella under which there are all these different issues and experiences. So any of these things are within transgender. Now you'll notice that outside of the umbrella is feminine woman and masculine men, and also cisgender. Cisgender is when the biological sex matches the gender identity and expression, and then that is cisgender. Rather than being like normal gendered and transgendered. There's a lot of politics around this actually, and some controversy. So We don't have time to talk about it right now because I'm running long anyway, but I'll just make note of that there's a lot in this. So let me go over a few definitions. First of all, cisgender, like I just said, it means that your biological sex matches your gender identity and expression. So then people accurately perceive your gender based on what they see, okay, which is not something that those who are trans can experience. Gender queer has to do with, I think I have notes on this somewhere, but I'm missing it. So gender queer is, someone might use that term if they don't necessarily identify within the gender binary. So they might say that they're gender queer, maybe some sort of combination. Transgender, like I just said, encompasses all the things under that umbrella. Someone who does not identify their matching between their biological sex and their gender identity or expression. Transsexual has to do with someone who goes from one biological sex to another. Passing has to do with a transgender person wanting to pass as a certain gender. This brings back in the gender binary, and a person can, if a person is, that's next. Transitioning from female to male, that's what F to M means. If someone is transitioning from female to male, they're going to want to pass as male, right? And the person who can pass as male then doesn't have to experience the challenge of or the discrimination or oppression that can come with being transgender, because no one is even thinking about it and assigns to them the kinds of rights and privileges that go with being male. Male to female, passing though would be passing as a woman. And of course, pronoun is very important. Because our whole language is gendered, right? And if you went to the training with Linda Hawkins, she talked a lot about this. But what I will say about it now is that for someone who is transitioning from female to male, that person may want to use he, him pronouns. Okay, and then the respectful thing to do is that when you're talking to that person, you talk about him instead of talking about her, right? Some people who are genderqueer or don't identify within the gender binary might want you to use they as a way of, that's not gendered, right? That could be feminine or masculine. Okay, so important observation, trans folks, for trans folks, pronouns are really important. When you think about, so often transgender issues begin to come up in childhood, and only about 10% of children who explore gender conformity will desist. So that means that like they're exploring and then they decide, no, I'm not transgender, and they go with the gender assigned at birth. Not all trans people identify their gender within the binary structure. So like I said, some people transition from male to female or from female to male, but some people who identify themselves as trans don't transition from one to another. They kind of transcend that gender binary. Not all trans people report discomfort with their physical characteristics. So for some people who transition, for example, from male to female, might want to have surgeries in order to kind of get their physical characteristics to match their gender identity. But not all trans people report discomfort with physical characteristics and would even want to have surgery or hormones or something to change their physical experience. If a person does not feel that their gender identity is congruent with their sex assigned at birth, then that person may make a transition, but may only make a partial transition, or may make no physical transition, but may simply want to be identified as their desired gender. So it may make a pronoun or a name change, but not make any kind of physical change. And some people do want physical changes. So access to interventions to ease gender dysphoria is increasing. Both physical and mental services for folks who are transgender is increasing, but can still be very difficult for people to access. Now, the reason that it's so important for transgender folks to have access to services is that there's a lot of transgender oppression and psychological disturbance because of the dysphoria that this creates, and also the societal privileges afforded to those who are cisgender, and then oppression and aggressions toward those who are transgender. So here's a few things to think about. Transgender people are subject to an alarming rate of discrimination, violence, and rejection. This includes outside events like threats, lack of safety, also anticipation of stressful events, just the stress of anticipating it. Rejection can create vigilance, make people isolate or hide. There can be internalized negative attitudes, like I hate myself. This reduces resilience. This can create other psychological distresses that are important to be aware of. And these outside events, these threats are real, and there are alarming rates of housing discrimination, healthcare discrimination, which makes homelessness and other violent activities towards transgender folks more common. This leads to mood disorder, substance abuse, suicidal ideation, and attempts. Alarming rates of attempted suicide for folks who are transgender and gender nonconforming. 41% of folks who are transgender and gender nonconforming. This is compared to 1.6% of the general population. So this is alarming, and as psychologists, something that we should really be aware of, and trying to support those who have transgender dysphoria and experiencing oppression. Okay, so support is more often available to those who are clear, open members of trans groups. But there's so much stress with regard to coming out that this can really get in the way of folks receiving the help that might even be there. There's not a lot of help there for them, but the support that is there for them, they might not be able to access. Okay, so recommendations for working with gender. First of all, I'll say that culturally appropriate treatment considers their experiences, their fears, and the internalized issues, so all three of those. And it's important to use a strength-based model, which means using the client's language, being sensitive to their experience, noting the strengths that they have and the resilience that they have that folks who have not had to have these experiences might not really have, and to notice what kinds of supports and strengths there are within their group. Assessment of transgender issues. Okay, so look for persistence as time passes, consistence across settings, and insistence, meaning that they insist that there is gender dysphoria, and it's distressing when it's not confirmed. Like when a parent or a teacher doesn't go with them, it's very distressing. I'll just lay out here the DSM criteria for gender dysphoria, which is that there has to be a marked difference between the individual's expressed gender and the gender that others would assign to him or her, and then that has to continue for 6 months, okay? And has to cause distress, which it would. This also, the DSM-5 adds a post-transition specifier, which ensures treatment for the folks who have undergone any kind of therapy and transition. This means that they can continue to receive services even when the dysphoria may decrease, because they still then have access to treatment and support services. Okay. There's a lot to say about decreasing the stigma. One of the things that happened with the DSM-5 is that disorder was replaced with dysphoria, and this is helpful because we're no longer saying that folks who are transgender have a disorder. We're saying it's a description of an experience that these folks have. Right, so no longer is the person ill, right, that they're experiencing something that is causing distress, and there's something that we can do to help them with that. It's not that they're disordered. Okay, so if you're working with someone who is transgender, there are things to think about with regard to deception. Is there something that they're trying to get out of being transgender? Or defining themselves in that way. There could be coercion, there could be trauma that is causing the gender dysphoria, there could be psychosis. It's important to rule those things out. Here are some things to say. So for example, what name and pronoun would you prefer for me to use? Let me know what terms you appreciate and how we can talk most openly about your body, your emotions, and your health. All those things are really important when working with someone who has transgender issues or dysphoria. Tell me about the first time that you knew that the inside of you and the outside didn't match. Tell me about when you realized that other people didn't see your gender the way that you did. When you say these things, it's going to tell the person that you're aware of the issues and help them help gain trust in the relationship. Tell me about a time when you realized that your true gender was however they would define themselves. When was the last time you were seen by a healthcare professional? There are healthcare issues that are at play here. And for those who have a gender dysphoria, they may either avoid healthcare because it's uncomfortable to talk about, and there is so much oppression or a history of oppression within the medical establishment, or they may try to do things to affect their physical, biological sex without receiving support and care from a physician, and that can cause their potential complications with that. And then, of course, educate your staff, those that you work with, so that your whole clinic can be sensitive to these issues. Think about care for the body, mind, and social systems. For the body, tucking and binding, so tucking the penis, binding the breast, those are common things for folks who have a gender dysphoria. Sex issues, sex can get kind of messy because expectations are about one thing, but for folks who are in some way transitioning, sex, like negotiating sex with partners, can be stressful. The mind, often folks have to wait in order to go through a transition to get medical clearance for treatments or for hormones or something like that. They may have financial limitations. They might not be able to go through the kinds of transition that they want. And that is very, very stressful. And so supporting them in the midst of that, also socially, this is going, a person who is transgender and kind of comes out about that, there will be ripple effects with the family. If they go to a school, if they're part of a religious community, with partners, this affects all of those people if they're going to transition. And so it's important to think in a systemic kind of way if you're working with someone who's transitioning or talking about gender dysphoria. And this may mean working outside of just the individual, like the narrow construct of individual psychotherapy. So it might mean group therapy, connecting with local support systems. It might mean working with a family or working with other collateral like a school or something like that. Okay, so we are over time. Thank you so much. Stay tuned. We'll talk more about this. There's so much here to talk about. We're barely scratching the surface. And bring your questions to class so I can make sure that I address kind of whatever questions you have on your mind that I maybe didn't address here. Okay, thanks. Bye.